Your surgeon called it a complete success. You went home relieved. And then, weeks later, sometimes months later, the world started going blurry again. Not the same blur as before surgery, a different one. A foggy, frosted glass kind of blur. And the panic that hit you in that moment was probably worse than the panic before the original surgery, because this time you thought it was fixed. This time you were told you were done. If this is happening to you right now, I need you to hear this first. You are not broken. The surgery did not fail, and you are not losing your mind. What you are experiencing has a name, it has a cause, and it has an incredibly simple fix that almost nobody explains to patients before they sign the consent form. And that lack of explanation is exactly what we're going to talk about today, because there is one specific thing surgeons routinely ask patients to agree to, almost as a throwaway line, that sets people up for this exact scare. By the end of this video, you'll know exactly what that is, why it happens, and the one question you should be asking before you ever agree to a follow-up procedure. Let's start with a moment everyone remembers. The day after cataract surgery. You wake up, you blink, and colors are suddenly sharper than they've been in years. Whites are whiter. The world has a clarity you'd honestly forgotten was possible. Your surgeon tells you the cloudy natural lens that was causing your vision problems has been removed and replaced with a clear artificial one. Done. Fixed. Permanent. And here's the thing. For the actual cataract, that's true. The artificial lens does not get cloudy again. It cannot develop a new cataract. That part of the surgery is, structurally, permanent. So when your vision starts fogging up weeks or months later, your brain does the only logical thing it can do. It assumes the surgery didn't work, or worse, that something has gone catastrophically wrong inside your eye. But here's what almost nobody sits down and explains clearly beforehand. Behind that new artificial lens, there is a thin membrane called the posterior capsule. Think of it like a tiny transparent pouch that holds the new lens in place, almost like a sleeve. Your surgeon doesn't remove this pouch during the original surgery, they can't, because the new lens needs something to sit inside. They just clean out the cloudy natural lens material from inside it. Now, consider this. In a meaningful percentage of patients, somewhere often cited between 20 and 40% depending on the study and the time frame, that thin capsule itself can start to thicken and cloud over time. Cells migrate across it. It becomes hazy, almost like cling wrap that's been left in a drawer for years. This condition has a real medical name, posterior capsule opacification, but in clinics it's often just called a secondary cataract, which frankly is one of the most confusing and misleading phrases in modern medicine. Here's why that phrasing is the real problem. The word secondary cataract makes it sound like a new cataract has grown back. It hasn't. Your lens cannot grow a new cataract. What's actually happened is that the support structure behind your new lens has clouded over. But because patients hear the word cataract again, they assume the worst. They assume failure. They assume they need another full surgery with all the same risk, recovery time, and fear they just went through. This is where the empathy part matters, because I want you to actually feel heard for a second. You did everything right. You researched the surgeon. You showed up to every appointment. You followed every post-op instruction to the letter, and now you're sitting there squinting at your phone, frustrated, maybe even angry, wondering if you got a bad surgeon, or if your body just doesn't heal the way other people's bodies heal. That frustration is completely valid, but it's also based on incomplete information that should have been given to you upfront. So let's get into where it gets interesting, because this is the part that ties directly back to that one thing I mentioned you should never agree to without asking a single follow-up question first. When this capsule clouding happens, the fix is not another full surgery. There's no incision, no new lens, no scalpel anywhere near your eye. The treatment is a quick outpatient laser procedure called a YAG capsulotomy. The surgeon uses a focused laser to open a small window in that clouded capsule, right in the office. Takes about 5 minutes, no cutting, no stitches, and most people notice clearer vision within hours, sometimes by the next day. It sounds almost too simple compared to the original surgery, and that's exactly why it gets glossed over in the consent conversation. It's treated as a minor footnote because technically it is minor, but minor doesn't mean unimportant when it's the thing causing your panic. Now, here's the part that almost nobody walks through clearly. And this is the actual thing I told you at the start to never agree to without asking more questions. When your surgeon, days or weeks after your original cataract surgery, has you sign a general consent form that includes language about additional procedures as needed or further treatment if required, that phrase can include this laser procedure buried inside it, described in such generic terms that you don't realize you're pre agreeing to a treatment plan without understanding what triggers it when it's actually necessary versus optional. And crucially, what the realistic risks are. Because here's where it gets genuinely interesting. And this is something that gets left out almost every single time. The YAG laser procedure, while overwhelmingly safe, is not risk free. It carries a small but real risk of a temporary spike in eye pressure, and in rare cases, it can be associated with an increased risk of retinal detachment down the line, particularly in patients who already have other risk factors like high myopia or a history of retinal issues. Most patients who get this procedure never experience any of that, but most is not all. And you deserve to know that before you nod along to a form that lumps it in with routine paperwork. So, why does this happen? Why does something this important get reduced to a signature on page 3 of a stack of forms? Part of it is simply volume. Cataract surgery is one of the most commonly performed procedures in the world, millions of times a year, and clinics move fast. Part of it is also that, from a purely clinical standpoint, posterior capsule opacification is considered such a minor, easily treatable event that doctors genuinely don't think of it as something worth a dedicated conversation. To them, it's like mentioning you might get a paper cut from the bandage. To you, the patient sitting at home, squinting at a blurry television months later, it feels like a crisis. That gap between how minor it is medically and how terrifying it feels personally is exactly where so much unnecessary anxiety lives. And it's exactly why this video exists. But that's only half the story, because there's a second layer here that makes this even more important to understand. And it's the part that ties everything together. Not every case of blurry vision after cataract surgery is capsule clouding. This is critical. If your blurriness comes with other symptoms, sudden flashes of light, a sudden increase in floaters, a dark curtain creeping across part of your vision, or pain, that is not the slow, gradual fog of capsule opacification. That combination of symptoms can be a sign of retinal detachment, which is a genuine emergency that needs same day attention, not a scheduled follow up next month. This is precisely why understanding the difference matters so much. If you assume every bit of post surgery blur is just the harmless capsule thing, you might delay seeking help on something far more urgent. And if you assume every bit of blur is a catastrophe, you'll spend weeks in needless panic over something a 5-minute laser treatment fixes completely. So here is exactly how to tell the difference, because this is the practical takeaway you actually came here for. Slow, gradual blurring that builds up over weeks or months, like looking through a slightly dirty window that gets dirtier over time, with no pain, no flashing lights, no sudden curtain of darkness. That pattern strongly matches posterior capsule opacification. It is overwhelmingly likely to be the harmless, highly treatable capsule clouding. Sudden onset blur, especially paired with flashes, a shower of new floaters, or any shadow creeping in from the side, is a different category entirely and needs urgent same day evaluation, full stop. No waiting to see if it gets better. Now, let's circle back to that consent form, because I promised you the one question you should always ask, and here it is. Before you sign anything that mentions additional or follow up procedures, ask your surgeon directly. If I develop posterior capsule opacification later, will I need a separate consultation and a separate specific consent process before the YAG laser procedure, or is it already covered under what I'm signing today? That single question does two things. It forces a real conversation instead of a glossed over mention, and it makes sure that if this does happen to you down the line, you're not confused about what's actually happening or why, because you'll have already had it explained in plain language by a human looking you in the eye. Instead of buried in legal phrasing, you skimmed past while distracted and slightly anxious before your original surgery. This is the difference between a patient who panics and a patient who's prepared. The exact same medical event happens to both of them. One spends 2 weeks convinced their surgery failed, losing sleep, Googling worst case scenarios at 2 in the morning. The other gets a slightly blurry day, recognizes the pattern instantly, books a quick laser appointment, and moves on with their week. The medicine doesn't change. Your understanding of it does. And that understanding is the entire difference between fear and calm. So if you take one thing away from this video, let it be this. Cataract surgery itself is permanent and remarkably successful for the vast majority of people who get it. But the body doesn't stop changing just because a surgery is over. And that thin membrane behind your new lens can cloud up months or even years later in a meaningful percentage of patients. That is not a failure. That is not your surgeon's mistake. That is a known, well documented, easily treatable part of the recovery journey that simply doesn't get the airtime it deserves before surgery day. Ask the question, get the real answer. Know the difference between the slow fog that needs a 5-minute laser fix and the sudden symptoms that need an emergency call. That knowledge alone will save you weeks of needless fear if this ever happens to you. If this video just connected some dots for you, or if you went through this exact scare yourself and wished someone had explained it like this beforehand, do me a favor and hit subscribe. Because there's a lot more in this channel about exactly these kinds of overlooked medical gaps, the things doctors assume are obvious that nobody actually says out loud. Drop a comment if this happened to you because someone else reading it at 2 in the morning, panicking just like you were, needs to see that they're not alone in this either.